Welcome to Next to Madison, a podcast to help you live your best life.
Hey, welcome back to another exciting episode of Next to Madison. I am your host, Madison Malloy, and on this episode, we are talking about women's health, but men, please don't tune out because there's going to be health tips that pertain to you as well. I'm sitting down with an amazing doctor who works in private practice, but specializes in the gynecology area. So she's going to be giving us kind of an overview of her specialties and also what we can do to live more stress-free, live a healthier life, be happier, all the things. We'll touch on hormones again because that is so important. It plays into your mental health factor. And men, this is important too because our bodies do work similarly, and there will be tips that you can use to be healthier. And also, I think it's important to understand how the female body kind of works, so you can kind of understand your wife or your girlfriend or your partner more, or your friends. So this will be a fun episode. I'm excited to kind of get into all the, good questions, because the number one thing that we need is our health. Our health really is our wealth. We can't accomplish anything else that we want if we don't have our health. So we will be right back after this quick announcement with our guest on this episode of Next to Madison.
Hey, it's Madison Malloy. I'm excited to announce that my new book, Time to Lighten the Fuck Up, is now available online and in stores. You can pick up your copy today by going to Amazon or barnesandnoble.com. This new book is a humorous self-help guide to help you remove the obstacles that are holding you back so you can take things less seriously and live a more enjoyable life. I'm so excited for you to read it. Now back to the show.
Welcome back. We are with our guest of the hour, Dr. Aimee Duffy. How are you?
Hey, I'm doing fantastic. How are you?
I'm so excited that you're here. And we're going to, in the intro, obviously, I said that we were going to talk about, because you're a functional medicine doctor, we were going to talk about, kind of female health. But I told the men, do not tune out, because these are going to be tips that will apply to you too. And also better ways to understand your woman in your life. Because sometimes you think, are they crazy? No, it could be a lot of other different factors kind of that goes into it. So I just want to give us a little bit of just kind of a quick overview of your background and kind of how you got to where you are today.
Yeah. Well, I was going to say, as you were reading that or talking about that, I'll go into that in a second. But I started a lot of this female hormone health in an OBGYN practice. And after I started doing it on females and recognizing that, men have hormones too, and men have hormonal imbalances too, and that there's, room for improvement there. And so in my OBGYN office, we closed the office on Friday afternoons, and then I used to have man clinics. So I would have men come in on Friday afternoons when there weren't all these pregnant women there and things like that. So I did that for about 2 years. For the usually it was the spouse of one of my patients, a partner or something, where they said, hey, do you do this for men too? Because, my husband has a lot of issues and we need to address it or whatnot. So it's kind of funny how you said that, because it is pertinent to everybody, really. So, now I have a regular kind of clinic, if you want to call it. So we see both males and females, although the males, the percentage is much higher females than males, but still. It's definitely beneficial. So way back when I was 17 years old, I got to experience delivering a baby or watching a baby be born. I didn't actually deliver the baby, but I was a babysitter as my career as a teenager. And one of the families that I worked with was having another baby. And so they invited me to be part of the process and be in the delivery room to experience it with them. And I just remember that moment of baby coming out and getting put on mom's chest. And I was like, this is awesome. Some people could be throwing up in the corner. It was disgusting, but really I was just like, this is the coolest thing ever. And I think I want to be a doctor. I want to deliver babies. That's what I want to do. I had already known I kind of wanted to be a doctor, but I thought I was going to be a pediatrician because I was a babysitter and I loved kids and whatnot. But when I saw that, I was like, no, this is what I want to do. So that's what I did. I went to college, medical school, residency, and I have, since delivered over 1,000 babies in my career. I delivered my own baby. That's a whole nother story we can talk about sometime.
Yeah.
So lots of baby delivering. And so what happens in this career is that if you're not delivering babies one day, then you're usually doing some sort of GYN or women's health. So I'm family practice by residency and by training, but about a year after I finished my residency, I moved into an OBGYN office. And so I was kind of delivering babies and doing primary care for the females there, and then started doing this hormone stuff.
Yeah.
And that's where we started doing Man Clinic. And then, as you might have seen, depending on where your area is, but I think it's happening everywhere, that big hospital systems are coming through and buying up, practices and kind of taking over the world, if you want to think about it from a healthcare perspective. And so the OBGYN office that I was in was highly considering, being bought out by the hospital to help with administrative costs. And I just was not happy. I was like, no, that's not me. I don't want to be owned by somebody else or told what to do. And I'm doing all this kind of woo-hoo medicine over here, with hormones and saliva testing and using supplements that we're providing from the office and that kind of thing. And so it just didn't fit with the box of, traditional medicine. So that was 12 years ago. I opened my own practice called Carolina Integrative Medicine. And that has since kind of grown from just talking about hormones and issues associated with any hormonal imbalances. Really, when we start looking at the bigger picture, it's testing what are your hormones, what are the deficiencies or imbalances, and then getting you back to normal.
Yeah.
And then I started doing that for gut health and heart health and brain health and, all these other things that encompass our lives, and recognizing for a lot of my patients, yes, you can do a test and you can provide a treatment, whether that's a prescription or a supplement. But if you're not getting to what's going on in their life in terms of what their home life is, what their stressors are, nobody has the magic pill, and everybody wants the magic pill, but really you've got to dig deeper and say, well, what are you eating? Are you moving your body? Are you sleeping? Are you exercising? What's your relationship like, and what other stressors do you have? And if you don't really pay attention and address those, then you're not going to see the improvement that people are looking for.
Yeah, because so when people come to you and they just say, I just don't feel well, I'm not sleeping, I don't have energy, is that typically your instinct tells you, all right, let's do a hormone test?
Yeah, I do. So when I first opened the practice, 12 years ago, that was my bread and butter. I mean, people came to me for hormones. We addressed that. And over the years, again, I've started to recognize that hormones is one piece of the puzzle. I call it the pillars of health. So hormones is definitely one of the pillars, but if you're not addressing the gut, nutrition, fitness, movement, detoxification, stress management, that sort of thing, then, you're not going to get the results you're looking for. So definitely hormones is a big part of what I do, but we go beyond that in our practice. But a lot of people come to us because they believe that they have some hormonal imbalance going on that's affecting them.
And I just feel like the whole talk of hormones has always been a thing, but I feel like more today that people are talking about getting your hormones checked, getting those in balance. But what's really unfortunate, from what I know, is that you don't have traditional medicine doesn't really provide these tests. So people that are on standard insurance or lower paying insurance, they don't have access to this. So they're just getting almost like running to their doctor saying, I don't feel well, I feel depressed, and being, here, take a Zoloft.
Exactly.
Instead of actually getting to the root of the problem, which is just really unfortunate. But it's just the way
it's very sad. I mean,
works.
when we look at traditional medicine in general, I mean, the top two prescribed medications in the country are Lipitor and Lexapro. So it's Lipitor is a statin, high cholesterol medication, and Lexapro is an antidepressant, right? And so, I mean, literally, those are the top prescribed medications. So again, it's Band-Aids not really looking for the source. So 100% agree with you. And that was certainly my frustration in the OBGYN field. You know, sometimes it is what we're taught. So it's not so much anybody's fault or, you know, lack of knowledge on the physician's part. It's just, you know, why bother? I hear this all the time, like, especially in a woman who's not menopausal necessarily. Well, even menopause too, we can talk about that. But like someone comes in, you know, I think my hormones are acting up, you know, I don't feel good, or I'm, you know, my periods are irregular or something like that. And should we test hormones? And generally speaking, in the traditional world, the hormone testing that's used, that is a blood test that's covered by your insurance, is almost always normal. So it doesn't really give you a good insight, partly because the reference range is so big. You know, so let's say, you know, we're looking at a progesterone level could be anywhere from 2 to 2000, depending on the age of the person and where they were in their cycle. And so there's not a whole lot of thought process into what should it be. So, you know, what's the reference range is just because they took an average of all the women who had their progesterone levels tested and put a 95%, you know, bell curve on there. And this is what, you know, what that looks like. So it's not only doing the right testing, but it's interpretation of what should it be based on the patient's age and where they are in their cycle, if they are cycling. So, you know, by human nature, it's like, well, if I do this test on 10 women and it comes back normal 10 times, it's not giving me any good data to help me decide what my treatment plan is going to be.
Yeah.
And in that situation, often the prescribed treatment is usually, let's put you on birth control to regulate your cycles, right? Or this must be hormonal. Well, we'll just put you on birth control. And so if you're going to do that, then it doesn't really matter what the tests are, you know, let's just do this generic, you know, here's your birth control, we'll fix it. Even if they don't need it for contraceptive purposes. I don't know how many women are in their 40s, done having babies, either, you know, husband's had a vasectomy or they've had a tubal or something, and then they're back on birth control to help their hormone symptoms.
Yeah.
And then the same thing, somebody's menopausal, you know, you're 55, you go to your doctor, you're over here with your fan, you know, I'm having hot flashes. There, you know, it's, do you have a uterus? Yes or no? And then, you know, depending on what that answer is, here's your pill. So again, there's very little insight into what is it that your body needs. It's really kind of generic. Let's try this, you know, estrogen replacement, and you need a little progesterone if you have a uterus, and you know, try it for 6 months, come back, see me. And, you know, if your hot flashes went from 15 a day to 5 a day, then we'll increase your dose a little bit. If you're better, then yay. And then there's very little conversation about how long do we stay on this? What happens, you know, later? And then there's the whole world of concerns with, you know, breast cancer and strokes and heart attacks and all kinds of stuff with that traditional hormone replacement, because it's really done, again, not knowing what the patient needs. It's very estrogen dominant, estrogen driven, and that's not always the case, and the reason behind that. So
I wasn't feeling good like end of May, June,
yeah.
and I'm like, something is wrong with me. Like I lack of focus, anxious, depressed, not feeling worthy. And I'm sitting here going, like, how can this be? Like, I have all these tools that if I, you know, to implement to get out of this place, I've learned, I feel like I've learned my lessons. I preach this positivity stuff, and all of a sudden I'm feeling like shit. So I went to a private practice doctor, and I went and had my hormones tested. And what they found out was that my testosterone was like in the trash. And as a woman, I wasn't thinking, oh, I must have low testosterone. It just
Right.
wasn't.
You don't think about that. Yeah.
And that was the thing. So I had the pellets put into my butt, like in my butt cheek, not into my anus, obviously, for people that are like, what? And so they just did the test like yesterday. So I'm hoping that they'll work. But yeah, she was saying that a woman's testosterone should be between like 200 and 300. Mine was at 19. And so she's like, this is probably why you're feeling like absolute shit. And then I had a thyroid issue. And so I was taking a thyroid medicine. I've been taking it for the past 5 years.
Yeah.
And because this was a private practice, they did more in-depth testing.
Yeah.
and found out that it was only producing T4, not T3. And the
Mhm.
T3 is what makes you feel better.
Right.
And so they switched the medication.
They
But
give you that.
I was
Yeah.
so fortunate, and I feel so much better. And it felt so blessed that I was able to do this. But there's so many people that cannot, and they just go to their doctor,
Hmm.
and it's not fixing the problem. They just medicate them.
Absolutely.
So I'm so
Well, and
thankful
again,
for
like had you
doctors like you
gone
guys.
to a, like you said, kind of a traditional practice, they may or may not have done any testing. They probably
Yeah.
would not have done testosterone, testing,
Yeah.
or just put you on birth control or, antidepressant because it sounds like you're just depressed. That's all the symptoms of depression, is fatigue and lack of focus and all that kind of stuff. So yeah,
And that's what I
it's
was afraid of. I was
unfortunate. It
like,
really is.
I'm not going to my primary care doctor. Absolutely not. Because I was like, I'm not a depressed person. I figured
Yeah.
this out. I've got the tools. I'm positive. I'm doing all this stuff. Something is wrong. And I was like, I am not going on an antidepressant. Now, if I needed an antidepressant, I wouldn't be against that, but I wanted to rule everything out before
Yeah.
ever going
If
down that
that's the
path.
end result, we can't find any other reason, then, that would make sense to say, I need this. Or, you're in a pretty severe place. If you're suicidal or something like that, you might need it to get you out of that
Exact
funk,
right.
and get you to a place where we can get to the root cause. But, that's
So,
what I do. And that's a lot of why, I enjoy doing stuff like this, where we're talking about these things because,
yeah.
I don't call it marketing. I call it letting people know. Because,
Hmm.
just like you said, I mean, people don't know that this even exists, that you can go, to another place. And it doesn't always have to be expensive. I mean, there's some, integrative doctors that do insurance or things like that. The reason that insurance doesn't cover it is because it's a lot of times considered, experimental, or it's just not standard of care. So, and for me, what I have found over the years, when I first started this practice, I was insurance based. And in the insurance model, really, in order to pay the bills, I mean, literally just pay the bills, you have to see so many patients a day because you only get paid, $38 when you might send a claim to the insurance company that's, $94 for a 20-minute visit or something. And then they go all through their mess. And then here you go, here's your check for $38 for that visit. That's what they decide it's worth. And, you can imagine if you're trying to, you know, only get $38 for each visit, then you got to see a whole lot of patients to,
Yeah.
cover the overhead costs and things like that. So one, I just had to see too many patients. And what does that do? It ends up, backing up the schedule. You get that frustration where you're only getting a few minutes with your doctor when really
Yeah.
you need a whole lot more time.
Yeah.
And to me, that was the most important thing, is spending time with people to help them understand, why are we doing something different? What is this about? Where is this coming from? Here's this, here's that, here's why. And, that takes a long time. Most of my office visits are hour-long visits. And even then, sometimes we go over because we just have a lot to talk about. So if we
Yeah.
really want to get to the understanding of why, and then what do we need to do differently, then you've got to have that time. And the insurance model doesn't give us an hour ever.
So it's so good though that there's even this option, and it's
Oh, absolutely.
yeah, it may be expensive, but again, like as I was, kind of try to preach, without your health, you don't have wealth. Your health is your wealth. You really can't
Yeah.
do
It's
anything
an
else if you
investment,
don't have it. It is into yourself, which is so important to obviously invest in yourself. So I want to talk about Plan B,
Okay.
because I feel that Plan B is a very dangerous medication. So women that either don't want to be on birth control, or teenagers who don't want to tell their parents that they're sexually active, so they're
Mhm.
not on birth control, will take, and now it's over the counter, right?
Right.
So they can take it at any time, they can do, but I feel like it's causing more damage. I will admit I have taken it in the past, and every time I did, I felt horrific
Yeah. Totally.
about a week later, and it would last a month or maybe
Mhm.
longer. What does it do to your body that's causing such, I mean, it can make somebody suicidal. It's a dangerous drug.
Yeah. I mean, it basically is, I don't know if you want to exact numbers, but somewhere in the range of like, if you're taking a regular birth control, where you're taking every day, you're taking, one pill every day. Plan B is somewhere along the lines of popping 4 to 6 of those pills all at one time. So it's just a super high dose of hormones, basically. It depends on where you are in your cycle and whatnot, but the whole process, the idea is that it's going to interrupt either ovulation. It can kind of halt ovulation if there was a potential that you were ovulating in that moment, and or if you're coming to sort of the end of your cycle, if you've already ovulated, that it's going to interrupt the progression of the uterine lining building up, which is where a baby's going to go settle and form.
Yeah.
So, in some instances, and this can be, moral, whatever the case is, is it inducing an abortion? We don't know, because we don't know. It totally depends on where you are in your cycle.
Yeah.
It could be inhibiting ovulation, which is a better end game.
Yeah.
Or, if fertilization, was able to happen, then it's preventing implantation. And that's where the morality kind of comes from that perspective. Are we, not letting this conceived thing happen?
Okay.
So it's a little tricky, and, there's different theories behind that and where it is, but that's kind of the idea of that. It's going to interrupt this process in some way or another in these huge doses of hormones, which is why you feel horrible, because our body's never made that, amount of estrogen all at one time.
Because I had heard that it can also start wiping out your testosterone.
I mean, if it's suppressing your other hormone, I mean, it's gonna come in and take over, and so it kind of shuts down all of your hormones. Now, I think birth control pills can do that too, which is why there's sometimes a side effect of decreased libido in women that are taking oral contraceptives, and that may be part of the issue, is the lack of testosterone, again, that nobody's testing, because they're not testing hormones when we're on birth control, really.
Yeah.
It's a tricky one out there. I mean, I think it is a little bit scary that it's over the counter, because in theory, it's supposed to be one of those not planned, I mean, this is an oops kind of thing.
Yeah.
Something happened, condom broke, or, unplanned event or whatever, and you have an option there. But, when teenagers are basically using it as their form of birth control, popping it every time they, have unprotected sex, or they don't want to tell their parents. And so they're using that as their form of birth control. And I don't think it was ever designed to be taken on a, any kind of consistent basis. I mean, it's supposed to be a one and done thing. Hopefully you learn your lesson and you go off and figure out what's plan A going to be, so you don't ever need to use plan B again. So, because it's over the counter, there's no control over that. There's no regulation. You can only get it once every 3 months or something like that. You just go buy it whenever you want.
Yeah, which is so crazy, because I remember when I had taken it in the past, like, it was, how I felt was horrific, like unbelievably bad. And I'm thinking, oh my gosh, if teenagers are taking this all the time, like, it is wreaking havoc on their body, and we're going to see a lot more negative results from it. Yeah, and the hormones are such a big thing. I'm going to say on record, if you're thinking about getting a divorce,
check your hormones first.
Go get your hormones checked first. Yes, because I feel like I was telling one of my guy friends about my whole experience and situation with the whole testosterone thing. And they said, oh my gosh, I think my first divorce happened because of hormones.
Probably.
Too late to go back now. But it was kind of an eye-opening moment hearing that story.
Yeah. Well, the tricky part is, you figured it out for yourself, but if he went and told his wife, who's irritable and, feeling crazy, that you need to go get your hormones checked, she probably would have left anyway.
This is true, right? Yeah,
So,
there's definitely an easy way to do it. That's why you both should go, because he could have an issue too,
Yeah.
Like it's not just
Well, and that's, again, I think hormones plays a huge role in that. And it's one of those, we have what we call this wheel of wellness. That's, health is part of it. And you could, put in health hormones and vitamin deficiencies and all kinds of stuff that we're addressing there, but then it's all the other things. So is your life affecting your health? Is your health affecting your life? It's cyclic. It's all over the place, so that's what I was talking about is I can address hormones and certainly get some improvement in symptoms, but somebody says, well, and women particularly, I think this happens, and again, doesn't have to be a stereotype, but women's libidos are very variable, I guess, for lack of a better word, in terms of where a decreased libido can come from 100 different places. So absolutely, there can be a hormonal imbalance, and testosterone is one of them, but also other hormones. So you can see it with low progesterone as well. You can see it in adrenal fatigue with low cortisol. And that is just kind of like, I'm so tired, and we generally, for most couples, they're going to have sex at bedtime. It's put the kids to bed and whatever. And, the guy's like, let's do this so I can get to sleep. And the woman's like, can we just go to sleep instead? Because, I'm done. Like, that's the last thing on my checklist for the day. And I just have no interest in doing that because they're too tired.
Yeah.
So, and then it has to become for women, mood, how they feel about their bodies. If they're a little bit overweight, then they're not feeling good. They're not feeling sexy. They have to like the person. And, sometimes we get irritable and, whatever, you're over here going,
Yeah. Oh, that's so funny.
I'm not very happy with my partner, spouse, whatever it is right now. So the last thing they want to do is have sex with them. They got to have an emotional connection there. So
can I tell you,
so multifactorial.
I went to a doctor one time. This must have been like, can't remember. It was years ago. But I said to her, I'm like experiencing like, well, like I'm just not that interested, and I'm in this relationship, and maybe I need something. And she turned to me and she goes, or you just don't like him that much. You ever thought about that? That was her answer.
Yeah.
No, nothing. She was like, I think you just need to reevaluate if you actually are attracted to this person. And I was like, what? Do you need a picture? Like what?
Yeah.
What kind of answer?
But that could be one part. I mean, maybe you certainly can look at other things, and especially if that that's not the issue and you feel like there definitely is physically something that has changed, then it's certainly worth looking at, hormones and things like that. But
yeah,
I think there's so many variables for females, particularly. Guys are pretty, sometimes they can get depressed and overweight and they don't feel good about themselves, but that generally doesn't affect them as much as, we see it in women.
Yeah. So let's talk about another big health issue, which is stress.
Mm-hmm.
So
Huge.
right, because there's so many uncontrollable factors in our lives that cause stress. So what are some things that people can do to help reduce their stress level so it doesn't kill them?
I think there's so many answers to that question, but one of the things that I like to talk about is this analogy. If you want to think about we've all heard of kind of the sympathetic versus parasympathetic nervous system, right? And just to explain and clarify, your sympathetic nervous system is what we call the fight or flight. That is, I got to get up, I got to run, the adrenaline rush, I'm getting chased by a tiger, I've got to run fast, I got to lift heavy things, I'm not going to stop to pee or have a snack, or if I twist my ankle, I'm going to ignore that and I'm going to keep going. Otherwise, I'm not going to make it. So that is up here. And oftentimes under stress, we're living in this, sympathetic place. And then the total opposite of that is something called parasympathetic, which is what we call rest, digest, and recover. So that's when we're sleeping, when we're more calm, and recovery, we stop and we catch our breath, and now we're down here. Now you think about, oh, maybe now I need to eat a snack, or whatever the case is. And in the perfect world, we are experiencing levels of both of those things, but really you only get to that sympathetic place when you are in that really, stressed out state of adrenaline rush kind of stuff.
Yeah.
You may go up a little bit because you go, oh, I've got an appointment and I'm late for that. And you can, that's going to be a little bit up there, but not anything like, way up here. And so we should have this nice, sort of wave, if you want to call it, instead of this up and then this down. And what we experience and what we hear stories all the time is somebody has a stressful event in their life, whether it's a health issue, a change in job, relationship status change, somebody, in their family passes away, or something that puts them up here.
Yeah.
And then just as they think they're, that stressful situation is getting better, they kind of start to come down, and then something else happens, and it's like, we can't ever get back to this rest and digest. Like, even when we're trying to sleep, we're still, our brains are busy and we're thinking about what we didn't do yesterday and all the things we have to do tomorrow. And, we can't recover from that. And so when we start thinking about how can we help our bodies manage stress better, one of the things that we talk about is how to be more parasympathetic. So you can literally Google, how to be more parasympathetic. And there's lists of things that you can list. And so meditation, comes into play with how do I bring my brain, I always talk about with patients, your brain thinks that you're getting chased by a tiger all the time. Like, in your world, if you're experiencing this stress we're talking about, and it's not real, because we know we're not being chased by a tiger logistically, but your brain senses the stress that you're experiencing in your life as the same signal. It doesn't differentiate. And so you have got to do things to tell your brain, I'm not being chased by a tiger, so anything that you can do to get into that, abdominal breathing, the meditation, the cold showers, are something that is interesting, because if you jump into a cold shower, a really cold pool, what do? We take this immediate like that, and then it makes you hold your breath, and then you have to breathe big. You're not in there go like that. You're going, okay, I can stay in here for a little bit longer. And you're like, big, deep breaths. And there's this really magical, sort of endorphin thing that happens when you're plunging into cold water and planning to stay there. So
that's become a big thing.
Yeah, that's what we use that as a treatment, and we've been talking about it. And our friend Danny DeNovo, talks a lot about it in her happy coaching and things like that, about cold water plunging, and whether it's as easy as finishing your shower and turning it as cold as you can possibly stand it for 30 seconds. Doing that before bed is actually shown to help improve sleep. So people think, oh, I should take a nice warm bath and calm down. And really, you should take a cold shower, and that will, start that parasympathetic mode, and actually helps you sleep better.
Is this something that you do?
Yeah, I have a hot tub, so I like my warm.
Okay.
But generally speaking, I will use, my relaxation in the hot tub time. And then depending on the time of year, I'll plunge into the pool, because my pool is always cooler than my hot tub. So I, try to go in for a minute or so. Sometimes longer in the summertime, or I'll go take a shower, and my shower is usually cold, as I'm hot tub to cold before I get in the bed.
And you found that has helped you sleep so much better?
Yeah, I think it just, whether it's sleep, whether it's, again, you're working on preparing for that rest, digest, recover time frame. So, that's where your body's going to bring the heart rate down. You got to be, cool. Your temperature needs to be cooler when you're sleeping anyway. So there's, things like that you can do. Essential oil, people talk about lavender, like, and other things. There's also your orange, your citrusy stuff, putting it kind of behind your ears is another trick to bring you more parasympathetic. That can be done not just with sleep, but like if you're feeling stressed out, that's I don't know if you can see that glowing diffuser back there, but I have orange in there today just because, my day is kind of busy. And so, if I'm sitting here in my office for whatever reason, if I'm, exposed to those essential oils that can just, again, just kind of remind myself I'm not being chased by a tiger today.
So is this something you can just go to like a natural, like a Whole Foods or a natural grocer and just get like a citrus essential oil?
Yeah. I mean, anywhere that sells essential oils, I mean, I'm sure just like any product that you're looking for, you can get cheap stuff and you can get, the better stuff.
Yeah.
Like for instance, sometimes you're at like TJ Maxx or Marshalls and they have these
Yeah.
little packs of essential oils and stuff. And I've purchased them before and I feel like you can put the whole bottle in the diffuser and you don't smell it. So
Yeah.
I think it's probably just diluted. It's not dangerous. It's not going to hurt you, but it just doesn't have much in it. It's got it's either watered down or just a regular oil of some sort that it's diffused in. So yeah, you want to go to a better quality. There's all kinds of websites. There's like you said, a natural food store, something like that is probably going to have a better quality oil, but I just use orange. I mean, orange oil, and orange is good for a lot of things like immune system support. Some people diffuse orange or lemon to, kind of clear the area of viruses and stuff like that too. So you can hear that about,
Oh, interesting.
keeping your home clean from a germ perspective, that sort of stuff. I'm not an expert in essential oils, so I'm just using that as example. There's
Yeah.
all kinds of stuff that we can use for them, and I think they have a place. When we're looking for something like, I would much rather somebody use a lavender or orange essential oil than me needing to prescribe them Xanax for their stress.
Yeah.
So it has a
Absolutely.
place. Now, we don't want to use essential oils for, full-blown pneumonia that you should be in the hospital for and thinking that you're treating something that we need a little bit more support with. So people give them a hard time because there are some people that really are diehard essential oil and they will only use that and they won't use anything, medication wise. And then that can get you in trouble if you really need something stronger.
Yeah, absolutely. I mean, those are great tips. I didn't even think about the cold plunge
Yeah.
before bed, and then even the
And
orange.
you can do cold plunging if you're at home. I mean, I wouldn't do it here in the office because I don't have a shower, but if you're in a really stressful situation, so somebody who's like having a panic attack or just super stressed out about an event coming up, maybe you're meeting the in-laws for dinner or something like that and you're kind of freaking out, like go get in the cold shower. Like literally, a 1 minute cold shower can redirect your brain out of that panic mode.
Because I've heard from somebody, I think it was probably a TikTok influencer, that the cold shower, like to end your after the morning shower, like end it with cold,
Yep.
it helps your metabolism for weight loss.
There's all this biohacking that's going on with cold showers, and so we're talking about it from an endorphin perspective, but I do think that there is some evidence. I'm not quoting the studies or anything like that, but there is evidence that it can help with fat burning, fat loss, that kind of stuff, because whatever the mechanism is, that kind of shocks your system. But I've heard that too, that cold, being in cold water is a way to kind of support metabolism. Yeah.
Yeah. So everybody stop with the hot showers. Go to the cold showers. So
Flip to the cold shower.
before we wrap up, I just want to talk about your book. Normal doesn't have side effects. So tell us a little bit about that and where people can get it.
Okay. It is available on Amazon now. And, really, like I was describing earlier, our goal is to look at what is normal. Like when I was talking about, that progesterone level and the range can be so out there. And that's what, people will use the word, is my lab within normal range, and what is normal, so there's a question about that. But particularly when we're talking about hormones, but really anything, when I'm talking to patients and saying, here's my goal is to get you back to normal. When your hormone levels are normal, when your hormone balance, is normal, when your, vitamin deficiencies are back where they're supposed to be, then we shouldn't expect to have any side effects. So if I'm prescribing this hormone regimen of testosterone or progesterone or whatever you need, or I think you should take some vitamin D or fish oil or whatever. And somebody says, well, what side effects should I expect? And, what I say is, well, normal doesn't have side effects. So I expect you to feel normal. And we don't need to go down the laundry list of all the things that you are used to experiencing when you get a prescription from a doctor, because that is doing nothing to get your body back to normal, right? So a person who's getting a prescription for Zoloft doesn't necessarily have a Zoloft deficiency, right? They may have a serotonin deficiency, but it's not working that way. So, all these chemicals that we're putting in our body have side effects because they're not really addressing, like we talked about, the root cause. So if our goal is to look at your hormone imbalance and get it back to normal, then normal doesn't have side effects. So that's really what our goal is to treat you, to get you to feel, you can call it optimal, whatever you want to call it. So many people just say, I want to get back to my normal self. Like, I want to feel normal. Everybody knows what that means. And if we can do it in the right way, then you feel great, and you don't, you're not on all these medications that you got to be chasing side effects for, or worried about, okay, I got to treat myself right now, but what does that look like for my future? Am I taking a big risk, with whatever treatment choice that I make? So yeah, that's where the title came from. I say it all the time, and it just kind of, became a running joke to some degree that I'm using that quote all the time. Normal doesn't have side effects. Normal doesn't have side effects. So it was like, that should be the name of your book. So
I think it's brilliant. I think it's going to really resonate with the listeners, because they're going to, whoever's on medication or certain things you're taking, supplements you're taking or whatever, with the side effects, it's kind of like, if it does have side effects, see what you can do to avoid it, because normal shouldn't have side effects.
Yeah.
So I think that is amazing. So where can people find you to get more information if they're in South Carolina, to come see you, all that good stuff?
Yeah. So I've got two websites. My personal website is amyduffymd.com. And that has the book link, that has, all my social media, podcast, TV segments, interviews, all that kind of stuff on there. And it does have a link if you want, how do I get to see you as a patient? It'll link you to my office, which is Carolina Integrative Medicine. Okay. And so that's carolinaintegrativemedicine.com. Generally speaking, if you put my name into, Aimee Duffy, into a Google search and put Clemson or South Carolina, hopefully I pop up there pretty high. Yeah. I work hard to get there. And so, even if you're not in South Carolina, I've got, sort of two goals. And again, why I do this, why I have such a passion, is I want people to know that doctors like me exist. So even if it's not me, that you're going to be able to see, because you're not local, it's an opportunity for somebody to go, what is integrative medicine? What is functional medicine? What is bioidentical hormones? And then maybe they can, like you, find somebody that's close by that could, even start that process of thinking outside the box and doing something differently. So,
well, exactly, because you want to fix the problem. You don't want to just mask it. So, spell your website though, because you don't spell Aimee the traditional way. So I want to make sure people that are listening can get to it.
It's Aimee is AIMEE, Duffy DUFFYMD.com.
Okay, perfect. All right, so you guys definitely check that out. And then, are you on any of the social media?
All of it. Yep. So, Facebook, Instagram, YouTube, you can find both. You can find Carolina Integrative Medicine and Aimee Duffy on all social media stuff.
And it's Aimee Duffy MD on all of them?
Should be. Yeah.
Okay, perfect. So yeah, you guys follow her. I'm sure, you can reach out if you have questions, or if you're not in South Carolina, Dr. Duffy might be able to recommend someone in your area. Yeah. But, we talked about hormones before. I shared a bit about my journey, and on another podcast, and then on this podcast again. If you can afford to do it, if you're just not feeling like yourself, get your hormones checked. It's just, for me, I'm so happy that I got the hormones checked, and I'm on the pellets before I hit menopause, because now I'm always going to have them tested and do this. So I should hopefully not have
it's kind of a preventative thing from that perspective. Yeah.
Yes. And
start
that's
getting them balanced off the bat, and yeah, it'll make that experience much more streamlined.
exactly. So I encourage everybody to do this. I know it's expensive, but your health is your wealth. So make an investment in yourself. But Dr. Duffy, thank you so much for coming on, and she's in between patients, so
Yeah.
we've got to let her go so she can go cure and help more people.
Yep.
But I appreciate it. And everybody listening, wherever you are, I appreciate you for tuning into another episode of Next to Madison. And we'll see you next time to find out who's next.
Hey, your host here, Madison Malloy. Please make sure to subscribe to the show on all podcast platforms, and please rate and review us on iTunes and Spotify. Also, if you have any questions or comments, you can email us at contact@nexttomadison.com. I thank you again for listening. Bye.